Hello and welcome to Electa Presents Transforming Healthcare and Improving Lives. Now, the cancer burden in India has been growing exponentially. The ICMR study indicates that 1 in 9 people are expected to develop cancer in their lifetime in India. Now, this number is expected to further go up, creating a situation of concern. Now, today, we have on our panel Mr. Manikandan Bala. He's Senior Vice President, India, Middle East, Africa and Turkey, and MD, India at Electa. Thank you so much, sir, for joining us. We also have with us Dr. Michael Schulder. He's Co-Director, Center for Stereotactic Radiosurgery at Northwell Health, USA, and he's also the Vice Chairman of Neurosurgery at Northwell Health, USA. And also in studio, we have Dr. Sandeep Vaishya. He's Executive Director and Head Neurosurgery at FMRI Grugrm. And also Dr. A.K. Anand. He's Senior Director and Head Department of Radiation Oncology at FMRI Grugrm. Now, our panel discussion will explore the role of technology in cancer care. The experts will address access to care and innovation in care, the 2 pillars of the solution architecture. So, to kickstart my first question, I want to bring in Mr. Bala. Sir, can you bring in a perspective on the impact of technology, on the impact that technology has on cancer care?
Thank you. As we are aware, in the treatment of cancer, we have various ways of treating. Say the surgical, the medicine, and the radiation, immunology, so on and so forth. But specifically around the radiation part, there have been multiple innovations over a period of last 40, 50 years. Majority of these innovations are focused on specifically the cancer cells being targeted by the radiation from an external and internal beams. Right. Over a period of time, we have had multiple ways of treating it using radium, cesium, cobalt, and then came the linear accelerator. Subsequently came the innovations on the software side of using these linear accelerators. But the primary aim continues to be targeting the cancer cells. But over a period of time, these innovations have also helped not just in targeting the cancer cells, but more importantly, ensuring that the surrounding cells have very least impact. And that's getting a lot of critical focus right now. So majority of the innovations, as we continue talking, are focused around optimal radiation to the cells needs to be targeted and very less toxicity to the adjoining cells and adjoining organs of the body.
Exactly, because it's really important to kind of, so to say, help give the radiation correctly without affecting the things around, the other parts around. But, Mr. Bala, just taking this ahead, now, Electa is known for being an innovator in cancer care, and in fact, I believe you're one of the largest companies of scale also to focus on radiation oncology. Your thoughts, and if you could shed some more light on what are some of the latest innovations that are available in India, and how especially this is now a game changer when we're talking about cancer care for specifically Indian patients. If you could shed some light on that.
Great question. Being a pure play radiation focused company, Electa's innovations are in multiple fields. When we talk of innovations in technology, we do have the linear accelerators, innovations in internal beam, which is the brachytherapy. We also have innovations coming in on the software side. But today, let's focus on 2 specific technologies. The first one is the gamma knife. So the gamma knife is a gold standard when it comes to cranial treatment, which is primarily the tumors in the head. Now, there are multiple beams focused specifically on the target, or in fact, multiple targets within the cranial space. And that's where gamma knife is a clear gold standard as the entire neuro and radiation oncology community subscribes. Of course, it's so much popular now that many other service providers or healthcare providers are using the name gamma knife. But then this continues to be the #1 preferred treatment on that. It's a non-invasive treatment. Even though the word gamma knife is associated with that, there is no surgical procedure there. It's primarily the radiation which is utilized in focusing on specifically the tumor, as I mentioned earlier.
Right.
And that's the gamma knife invention. The latest version or the latest gamma knife which we are talking of does continue to have innovations in terms of the planning, in terms of the precision, so on and so forth. The other technology is the MR-Linac technology. Again, a lot of innovations on the external beam. As I mentioned earlier, MR-Linac is the latest one on that. What is MR-Linac? MR is the gold standard soft tissue imaging. The Linac, of course, is a powerful Linac which is being used to target the specific cancer cells using radiation. The fusion of these two amazing technologies, the MR and the Linac, has given us a very unique opportunity to treat the patient with so much of precision, because we now combine the gold standard of imaging, which means as we are treating, we are able to see exactly what happens, that specific part which we are treating. So those are real great advantages which come in through innovation.
So it's a proper live, so to say, relay of what's happening. Therefore, the clinicians, the doctors are able to exactly see it to ensure the best result or the best treatment is being able to be given. From your perspective now, I'll just expand the perspective. I'll bring in Dr. Michael Schulder for this. Dr. Schulder, you've been using the Gamma knife in your practice for a while now. If you could just share your thoughts on your assessment and the clinical opinion on the treatment quality of the same.
So, Sumit, I'd just like to clarify, I am a neurosurgeon. I still do a lot of open neurosurgery, and I choose the treatment that's best for the patient in conjunction with my colleagues in radiation medicine. So like Elekta, which develops the Gamma knife, but also develops various linear accelerators, or LINACs, as Mr. Anand was alluding to, it's analogous, because in each case, Elekta, but also I as a neurosurgeon, go with what's best for what a particular patient needs. I've been working with the Gamma knife now for 10.5 years. Before that, for a previous 18 years, I had worked with pretty much every linear accelerator or LINAC radiosurgery system on the market. And you could do good radiosurgery with a LINAC. I think it's wrong to pretend otherwise, but there's no question that the Gamma knife is the effective way to deliver stereotactic radiosurgery, focused radiation to treat benign tumors, malignant tumors in the brain, as well as other conditions that are not even tumors. And those include things such as arteriovenous malformations, trigeminal neuralgia, and other conditions that, if there's time, we could get into later on. That is my experience, and I'm happy to stand by it.
Fantastic. So we will come back to you in a bit further for some more questions, Dr. Schulder, but I just want to move here back to Dr. Sandeep Vaishya. So just wanting to bring in your perspective from an Indian context, because I know you've been also been using the treatment and you've been doing treatments with the system. But what's been your experience? What's been your opinion? What have you observed?
Sumit, so we have just started the latest generation of Gamma knife at our hospital, and the experience till now has been simply amazing. By the way, it was the first installation in South Asia. Typically, what Dr. Schulder also mentioned, the tumors that you'll treat with Gamma knife are both benign and malignant tumors. Benign tumors like acoustic, meningiomas, pituitary tumors, and they can be treated primarily, particularly when they are small, or sometime after surgery, if some tumor is remaining, then you can treat it with Gamma knife so that it doesn't grow back again. Because if it grows back again, then patient will need another surgery.
Right.
So it is to prevent that. Then other non-cancerous conditions like multiple metastasis. This is one of the best ways to treat multiple metastasis because it is so precise that it avoids radiation to the normal brain tissue. And because of that reason, sometimes metastasis may come back again. There may be newer metastasis. So you can easily treat it with Gamma knife again and again.
Okay.
And then there are non-cancerous conditions like arteriovenous malformations and trigeminal neuralgia. It is amazing for that. So in the last 6 weeks since we started, we have practically treated all these conditions in more than 40 patients now.
Right.
And as I mentioned, the experience was pretty good. The latest version of Gamma knife is so versatile that we are able to treat many more conditions that we were not able to treat before. Okay. So it's been pretty good.
That's important to see that, because if you're able to treat more conditions, therefore we're able to expand the scope, technology improves, in every space, and especially in medical healthcare, if you're able to provide better technology for a better treatment to people, it's always helpful for them, beneficial. Dr. Schulder, I'll come back to you. Just what is, in your opinion, is the potential of this technology? Is it currently being used optimally? What would you say?
I think that the consciousness of the use of Gamma Knife needs to be increased amongst referring physicians and also patients and families. And that's true around the world, even though it's been a technology in use in the so-called West for 5 decades or more. We should emphasize that this is now the 6th generation of Gamma Knife that we're using. It's essentially a new device, and it is really a revolutionary advance in how many intracranial, or I should say problems in the brain, can be treated. I would say patients and families need to be aware of this and to ask their doctors if they are suitable candidates for these treatments. And in many cases, by them asking, they will open the door to getting a treatment that is safer and less invasive, and at least equally effective to perhaps a much more invasive and risky surgery.
Absolutely. That's a very important point that you brought, Dr. Schulder, about the important conversation that should happen between patients and doctors, and I will come to that in a bit. Coming back to Dr. Vaishya, sir, in our earlier conversation, and Mr. Bala also spoke about that Gamma Knife is kind of the gold standard for stereotactic radiosurgery, or SRS. Wanting to get your thoughts, if you could be able to shed more light on the benefits for our viewers, if you could shed more light on the benefits so that our viewers are able to understand what is the SRS treatment, how is Gamma Knife the gold standard for brain SRS, that would be helpful.
So first I'll tell you what is SRS. SRS means stereotactic radiosurgery. In this you place very highly focused and very precise radiation beams onto the target, whether it is a tumor or non-tumorous condition. So the radiation beams are so focused that the surrounding brain tissue is spared. As compared to general radiotherapy, you'll see that the patients, sometimes they'll have hair loss or other things. Here, all the tissues are spared. The radiation goes only to the tumor. Now, why is it gold standard? Because there are many technologies which do stereotactic radiosurgery. Gamma Knife is the only modality where the patient, basically the target, that is the tumor, and the radiation source, both are fixed. Nothing is moving. So there are no moving parts. So it is absolutely precise. And Gamma Knife can provide accuracy of less than 0.3 millimeters, which is unmatched by any other technology. And that's why it spares the normal brain tissue, and particularly in metastasis, where suppose a patient comes with 20 metastases. If you treat by any other modality, if you give that much radiation, so normal brain tissue will get a lot more radiation than you desire. And in the long run, it can damage the patient's brain. Here it is so precise that you can treat all of them in one go. And at the same time, if patient develops newer lesions, then you can again treat that without any fear.
Dr. Anand, I'm wanting to bring you in. From the Gamma Knife, I wanted to shift to the MR-Linac. As a practicing clinician, you are also, if you could explain to the viewers, mainly the difference between the MR-Linac treatment and traditional radiotherapy. Just from your viewpoint, if you could guide us on that.
So I think what MR-Linac is doing is, conventionally, we had a linear accelerator which came into being in about year 2000 in India. It's about 23-year-old. But it was based on CT scan. Now this technology of MR-Linac, now the targeting of the tumor is done by MRI. So as a layman also, you would understand, whenever you get diagnosed by a tumor by a CT scan, immediately your doctor will say you get an MRI. Because MRI visualizes the tumor so clearly that it helps surgeon, it helps radiation oncologist, because we can see the tumor clearly. And when we can see the tumor clearly, we can focus our radiation beam very, very precisely on the tumor. So what ultimately it leads to? It leads to improvement in cure rate, as well as reduction in toxicity and better quality of life, as I started. So ultimate aim is improving tumor control and improving quality of life.
Mr. Bala, I'll come back to you. So while we know that India is a real fast adapter of technology, and we're seeing that in fields across the board, in the space of medical technology, and specifically what we're talking about today here, cancer care, can you elaborate on how some of your innovations will reach the Indian patients?
Very interesting perspective here. Let's step back and look at how India is progressing. Unfortunately, the cancer incidences are only growing. And for a massive population in India, cancer is a significant burden at this point. As per WHO guidelines, talking of the infrastructure to treat cancer patients on the linear accelerators, we need 1 linear accelerator per million. Right now, we hardly have 0.4, which means we need much more than double the number of linear accelerators available in this country. And that's one perspective. And that's where do we tend towards treating a lot more patients on the normal side of treatment of cancer? Right now, the infrastructure is clearly lacking. The other side of it is the technology, the innovations which come, and the value pertaining to it. Cancer doesn't differentiate between rich and poor, between emerging and developed countries. And everyone struggling through that cancer treatment will need to get the best treatment. And that's where new innovations and technology, like what we are discussing, the gamma knife, the MR-Linac, comes into play. Let's take MR-Linac, for example. Worldwide, 80 centers are treating patients, and India has already adapted to it much earlier. We are now progressing well within this country as well. So on the other end, as I mentioned, India is clearly an early adapter. It's not just about technology. We have been discussing with experts here. They are not just experts in India. They are one of the best in the global scenario as well. So as the skills of the clinicians also increase and demand these technologies, the innovations are adapted faster into this country. So overall, as the innovations happen, yes, India is definitely on the forefront of providing the best care to these patients.
Hey, fantastic. That's very important. And thank you for shedding light on that important point here. Dr. Anand, just coming back to you, if you could share some your thoughts on some of the benefits for the patients with MR-Linac treatment, and what are the expected outcomes for them?
So, as Mr. Bala just said, so this technology is evolving. And we have started seeing excellent local controls, better local control than a CT scan-based linear accelerator. Case in point, I can tell you there is a recent publication on pancreatic cancer, where they have shown, because pancreas is a hidden organ in the body, and if you try to visualize with a CT scan guidance radiation, the pancreas is not clearly visible. So if we can't see it properly, we can't give radiation to that precision. Now with the improved precision, we are able to give higher dose to the pancreas. And it has led to an improvement in cure rates in pancreatic tumors. So I think there are so many disruptive technologies which are coming up with MR-Linac that the control rates are improving. That is the biggest advantage, is the tumor control rate is showing improvement. And on top of that, we are beginning to see considerable reduction in side effects. As you would know, everybody is scared of side effects of cancer treatment. Cancer is a deadly word. The treatment is also equally, for people to understand. So MR-Linac type of technologies are meant exactly for that purpose.
Mr. Bala, coming to you for the final word, just your thoughts, your message for our viewers.
Yeah, Sumit, even in today's discussion, I did listen to this word like scary and dreaded disease, and that's a true reflection of the society on this cancer.
Absolutely.
But fear no more. Hope is on its way, in terms of the clinical specialists, the expertise which we get through these gentlemen who treat cancer, plus the technology, the innovations in technology, not just about treating, also about ensuring that the lives are much better in comparison. So clearly, we do have a lot of hope coming onto the patient's way, and the clinicians, the companies, the technology, the solutions put together is definitely out there to ensure a better life. We are here till cancer isn't.
That's very well put, Mr. Bala. Thank you so much for that. Thank you, Dr. Vaishya. Thank you, Dr. Anand. Thank you, Dr. Schuler, for joining us. Ladies and gentlemen, you've been watching this special series, special episode you've been watching, which is Electa Presents Transforming Healthcare, Improving Lives. And I hope you're taking back some very important points from today's discussions. A lot of points have been raised and explained, and I'm sure that will be putting many of our worries at ease. Thank you so much for watching.